if you were told that the very food on your plate could be turning your life-saving medication into a toxic hazard or wiping out its benefits entirely? Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Today on the show, we are breaking down the eating battle happening right inside your stomach. We are joined by a veteran dietitian and nutritionist to uncover the everyday Nigerian meals that don't mix with your medication and how you can eat your way to through recovery without a technical itch. Stay with us. The program continues in a moment. The program is still Sound Health on Lagos Television. Join us via Zoom this evening to take a look at food-drug interaction is Uju Onora. She is a registered dietitian and nutritionist. Good evening, Uju, and thanks for joining us.
Good evening. It's a pleasure to be here. Thank you so much for having me.
All right, thanks for always. Yes, let's start the show by asking this question. Can a meal affect the efficacy of a medication?
Absolutely, right. So this is typically called food-drug interaction, and then sometimes people call it nutrient-drug interaction. It's a bit interchangeable. So this is basically when a meal, when taken with a drug, right, or a drug when taken with a meal, whatever way, right, affects the efficacy of a drug. And by efficacy could mean a lot of things, right? And one particularly being that it improves how well the drug works in the body. But on the other, the downside, it could also be that it impacts negatively on how the body, uses that drug, maybe in terms of absorption, metabolizing it. And then in extreme cases, right, it could also, cause side effects. So absolutely, yes. When we take a drug, right, with a meal, it could, positively and or negatively impact on the efficacy of a drug.
All right, some people seek medication in food to use, while others use soft drink. Is it safe medically? I've seen people say, I cannot use this drug without taking it with a particular soft drink. Is this safe medically?
So it's a question of oftentimes we think about it this way that soft drinks and even in cases because I've seen patients that take energy drink with their medication.
Really?
Soft drinks, energy drinks contain caffeine more oftentimes than not. I mean, caffeine is oftentimes the one of the key ingredients in these drinks. And caffeine itself is a compound that could bind with drug and impact on the efficacy of the drug. It could slow the absorption, and even in some extreme cases, it cause increased heart rate, heart palpitation, drowsiness. But particularly, even if because I mean somebody might be listening to this and say, oh, but I don't experience this thing when I take my medication with soft drink or energy drink. But particularly on the foundational level is the fact that caffeine, as well as other compounds, or substances in soft drinks and energy drinks, can reduce the absorption, that is the body absorbing the drug or metabolizing the drug for what it is intended for, right? And if that's the case, then there's no point taking it with that. A rule of thumb I usually recommend people when taking drugs is to, as much as possible, take it with room temperature water. Not hot, not cold, just room temperature.
Not even with tea.
Not even tea, because I know people that use tea. I mean, I know this personally, right, in my interaction with patients. Now, tea on the other hand also, and by tea, I'm gonna be, clarify that I do not mean, what we call in our side of the world, hot milk with chocolate drink. No, that's hot chocolate. Now I'm talking about proper tea. Tea being a tea bag, right? Or leaves or plants infused in hot water and it boils. That's tea. So now people who take tea with their drug, that's another downside. Now tea could also, the compounds in tea may also bind with this drug and reduce its efficacy. So it's a lot of conversation. And then you also think about it from the point that some drugs are heat labor, and using hot tea can also could even affect its efficacy. Before it even gets to the body, you have already, I wouldn't want to say destroy, but you have almost reduced its impact. So these are things to think about. And just as I said a few seconds ago, the best bet is room temperature water. And in cases, because I understand that there are patients who, or people who are not able to take drugs, without this, just with plain water, it's important to speak to your doctor before going that route of using a food or using a drink to take that drug or medication.
What about milk? I have seen some people use the medication with milk. And are there actually foods, spices, fruits that affect, that they don't align with some medication?
Okay, that's also another angle, and it's very, very good that you asked, because I would like to think that many people are often, I wouldn't say heavy, but very good milk consumers, right? So milk is a very rich source of calcium, right? And calcium in itself, for example, can impact on the efficacy of a drug. For example, antibiotics, tetracycline, ciprofloxacin, and a couple of other medications, antibiotics. Calcium affects thyroid medication, and calcium is found in milk, calcium is found in yogurt. Primarily, these are very rich sources of calcium, but of course, there are other sources, right? But in the context of what you asked. So when you think about the fact that calcium can bind, I'm going to use that word, bind with the drug to impact on the body absorbing it, impact on the body metabolizing it, and it's not going to do what it's intended to do. Or even if it does, it's just going to be at a minimal level, not at its optimal. So yes, milk is also something I would say, if possible, plain water. I am a pro plain water advocate for taking medication. And by plain water, I mean no additives, nothing, and at room temperature, not cold, not hot.
All right. What happens when a patient complains about feeling nauseous, bloated, or some not so good experience after using a medication? What should be the next step?
It might be wrong, or it might be too quick for one to assume that it's maybe from food-drug interaction, right? It could be a couple of things. It could sometimes be the timing of the drug. It could be a side effect. It could even be an allergy. So maybe the person's body does not like that particular drug. So there's a lot of factors. It could also be that it's a contraindication of maybe an underlying medical condition. So if maybe someone has an underlying medical condition, they cannot take certain drugs. And so giving it to that person is going to create some additional problem. So what typically health professionals, what we do is to assess the situation. It's not okay to maybe discontinue the drug just because of that. You try to assess the situation. What did the person take with the drug? What time did the person take with the drug? Are they under other underlying, medical conditions, which may impact on why the body was not receptive enough to that medication? So these are things to always think about. Is there an existing allergic condition, why that person is not receptive of or having a side effect to that drug? So you think about all of these things holistically as a health professional, and then it helps to make a better diagnosis of the situation and whether to discontinue drug or continue it. Because sometimes side effects too could just be momentarily, the body trying to get used to that drug. Over time, the body is fine.
All right. Can this situation aggravate side effects in patients?
This is, again, just like I had mentioned a couple of seconds. It's important to understand that food drug interaction can cause side effects, right? But again, we can't always know if it's food drug interaction except assess the client properly or the patient properly. But yes, food drug interaction can cause side effects. For example, a very typical example that we would like to think even most people do know is taking NSAIDs, non-steroid anti-inflammatory drugs, on an empty stomach. over time, it can cause ulcer because the stomach lining that irritated. So NSAIDs are best taken with a meal. A typical or even common examples are taking green leafy vegetables when an individual is taking a blood thinner, maybe heparin, warfarin. Now, this can impact on the efficacy of that blood thinner. So this is not to say one shouldn't take vegetable, your ugu, sultan pumpkin, your spinach, but it's important that timing is so important. Timing matters. If someone were to take an iron supplement, which is something that typically majorly women, take because of the monthly, cycle, 2 to 3 hours before, after meal, or after their meal, that's when it's best for them to take an iron supplement if they took or they intend to take tea. Now, because again, tea, like I had mentioned a couple of minutes ago, has compound that can bind with drugs, example, and iron, and it reduces efficacy. So it's not good, it's not advisable to take iron supplements and then with tea. So probably 2 hours later, 1 hour at most, at the very least, before or after taking that drug. That's when you can take tea.
All right.
A couple of other things also, you think about it from ginger garlic turmeric also can contraindicate, affect the efficacy of blood thinners. And I mentioned about antibiotics too. So when you think about all these things, it's important to understand that side effects can actually ensue from taking drugs with or without meal, as the case may be.
Okay, Uju, thank you so much for that clarification. How do you minimize experience from food-drug interaction as well as reduce medications' efficacy or effectiveness?
I think a rule of thumb is to first speak to your healthcare professional. That is number one. And when I say this, I'm going to say this in simultaneously with saying, do not self-medicate. As simple as maybe that headache is, or that thing, whatever you're experiencing, it's important to not self-medicate, because you do not know that in self-medicating, one might be eating something that may impact on the drug that they just took. So first, speak to a healthcare professional at every point that is a medical condition, whether the barest thing. The second thing is the leaflets, the instructional leaflets in medications are there for a reason. People ought to take time to read those instructional leaflets. Sometimes you see an instructional leaflet that tells you take with a fatty food, with an oily food. Sometimes you see an instructional instructional leaflet that tells you take after 30 minutes after a meal, take 30 minutes before a meal. These are all instructions that you may not know if you don't read that instructional label. So this is the second thing I say. One, speak to a healthcare professional. Second, do not self-medicate. Thirdly, read the instructional label of the drugs as much as possible, and then also keep watching your body when you take a meal and see how your body responds to it.
I think we need to do more advocacy about reading of medication leaflets or labels or guide before using medication, because I know many people are guilty and they are on this table. We do not actually do that. Okay, so okay, I know you've been giving us tips and highlights on how to minimize food-drug interaction. Let us look at a golden rule of thumb from you as a nutritionist on how to reduce this food-drug interaction, as well as actions that will support healing rather than blocking efficacy of medicines.
I think what a golden rule, I would say, right? My golden rule would be to do not treat medications and food in isolation. Because think of them as partners. And so if they are partners, it then means that there would be in cases where they should collaborate, and then in cases they should not collaborate. I'm trying to just choose these terms, right? So by collaboration, I would mean, there are cases where you should take the food, as a particular food and a drug together, maybe a fatty meal with a kind of drug, or don't take a meal at all, or take a meal after 30. So the personal golden rule will be think about food and medications or drugs as partners. Do not treat them in isolation. Again, as I said, earlier in the call, right, is to also think about this as speaking to a healthcare professional before taking any medication, reading the instructional labels, and as much as possible, I think that we as individuals too should generally eat a balanced diet. There is no reason at all alcohol should even be found in your diet in the first place, because I know people that take medications with alcohol. But in the first place, there's no reason why you shouldn't be taking an alcoholic drink. I mean, because of the side effects, or when I wouldn't say side effect, the health impact of taking alcoholic drinks can affect blood pressure, can affect weight, and a lot of other things. So there's no reason. So when we focus on a healthy diet as a normal, as our habitual lifestyle, it even becomes easier to, manage food-drug interaction. But when someone already has an unhealthy eating habit, it's hard to manage ensuring that food or whatever you eat does not affect the efficacy of your drug.
All right. Speak with an expert. Do not self-medicate. You also need to report symptoms early enough if you feel unwell. One point I'm taking home with me tonight is the need to read instructional labels of medication. Thank you so much, Uju Onura, registered dietitian and nutritionist on food-drug interaction.
Thank you so much. Thank you for having me.
You're welcome. Sound Health continues with trending health report from around the world. Please stay tuned. You are what you eat, but what you eat can also change how your medicine works. Take precautionary measures. Think safety. Speak with an expert if you feel unwell. This is why we say thank you on today's episode of Sound Health. Remember, you also need to read instructional labels, instructional guidance of medication when administered. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.